I want to follow up on that question, Ms. Jocelyn Ottawa, and the union claiming that it's more misunderstanding than mocking. From what I heard, what you said in French, you're not buying that excuse that they're saying, and I wanted to know why you don't think so, and why you think that this is an explanation after the fact that doesn't hold water.
Look, Mike, I'm not going to question what the union said. I think the explanation itself, I will have questions about it, and the facts that surround it. As I said in French, no one asked me. I don't know what the claquette is in English. I think it's originally an Irish dance, but no one asked me to sing a jig or do a little jig before getting healthcare services, and yet apparently this person was asked to sing in Atikamekw. Maybe the sentiment behind it was there was some good faith, but come on, it doesn't make sense. And this is about getting first-class care to people who have been denied it in a system that in a country that prides itself on its healthcare system. It's equality and access for all. And Tom and I are spending countless hours trying to deploy a vaccination strategy that treats Indigenous peoples as first-class citizens. And we see the challenges. This is if it wasn't racist or bigoted, then what was it? And I think then you get into questions about what systemic racism is, and that you can't address it through successive policies of what equates to some form of whack-a-mole. You could fire everyone, but at some point there's not any more people to fire, and you have to start talking about the system and perhaps the course that these people were given. I don't like to indict any particular individual without a whole set of facts, but when you start seeing behavior and a system that perpetuates that behavior, then I really do think you have to have a discussion about the system and how it treats Indigenous peoples, in particular those that are felt vulnerable. Any discussion about systemic racism is about the impact left on those who suffer it. And we've had this discussion around use of words, use of language, but you have to have a sensibility and sensitivity to the impression that might be left on someone that is at their most vulnerable at the point of care in the healthcare system.